Welcome, everyone. Thank you for joining us, particularly those who just tried to join our live stream and then it didn't work because the technology failed. But hopefully, I think we are all going well now. So to everybody watching, if you could give us a thumbs up or a wave or just even a comment to let us know that everything is working well, that would be great. Today, we are talking about sepsis in babies and children. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPR Kids. And I am coming to you today from Gadigal. And I am joined by the fabulous Dr. Amanda Harley, who is the Paediatric Sepsis C&C for Children's Health Queensland. So, Amanda, please, can you tell us a little bit about what you do?
Thanks, Sarah. Well, what I do is not technology, so I'm very glad that I was not in charge of this, or we still wouldn't be streaming. So that's what I don't do. Thank you very much for a warm welcome. I'm very excited to be here this afternoon now, even though we're a little bit backwards in Queensland and it's still 12 o'clock here, but don't hold that against me. Essentially I look after the state of Queensland in terms of really focusing on clinical education and training to doctors and nurses and allied health professionals around the state, and also some work with communities and families around what sepsis is, how we can get better at recognising it and treating it. I am also an emergency department nurse. Don't hold that against me. I'm the cranky person at 3 a.m. that needs another instant coffee likely. But that is my other role within one of the busiest emergency departments up here on the Gold Coast. But with that role is obviously, and I'll touch on this a little bit later, is just how important you guys are as parents and families, and the nurses and the language and communication that you convey to us nurses around your child and what their needs are. Because I had a bit of spare time a few years ago, I decided to do my PhD in paediatric sepsis. And what that big fancy word means is essentially someone that wants to learn a little bit more about a specific condition and really contribute to the knowledge in Queensland, in Australia and internationally, to try and really get better at understanding how we can recognise sepsis and treat it in children to essentially save their life. So that's me in a nutshell.
Oh, I tell you what, I am glad you are around, Amanda. You are absolutely doing extraordinary work. And today, obviously, we're here to answer your questions. So if you have any questions about children, babies, sepsis, so on, please type them in the comments below and we will get to them. Thank you to everybody who has already submitted questions as well. We will be going through them. But I think the logical place to start right now is, Amanda, can you tell us, please, and I know this is not a simple question, but can you tell us what is sepsis?
We've gone right for the big question in the beginning. Thanks, Sarah. So firstly, sepsis is still really, the definition is debated across international experts everywhere, but we're not going to go down the big fancy definition pathway. Essentially, what you need to know about sepsis and what it is it's the body's overwhelming response to any infection. So let's use an example. You're a baby, you might have a urinary tract infection, or they might just start to develop a chest infection. That's a simple infection that they will get better from. But when sepsis occurs, the body has this almost haywire response for reasons we're not entirely sure of. And the body goes into this response where it starts to damage its own organs and tissues to try and heal itself, essentially, or we don't know why it's doing it, but that is where the damage occurs, because it's gone from a simple urine infection to suddenly the body going, what is this? I'm going to start to damage myself in the process. And that's where it gets a little bit scary, but that is what sepsis is.
Yeah. So I guess what I really take away from hearing you say that is that sepsis isn't the infection. An infection can cause sepsis. And I think that's, a confusion that's out there a lot, thinking that sepsis is its own thing like that. So thank you for clarifying that. But I think probably the most logical next place to go to before we start getting into some questions is, how can you identify sepsis? What are the signs and symptoms? Because I think that's probably the number one thing that parents and carers of kids out there, they're like, well, how do I spot it? What do we need to look for?
Yeah, perfect. So a couple of ways to think about that is, so the first thing is obviously because it can occur from any infection whatsoever. So sepsis does not discriminate in any age group. even obviously up into older adults. And we've probably heard about that from older adults as well. So whether it be a chest infection, whether it be a skin infection, your child falls off their push bike and they've got an infection there. The signs and symptoms of sepsis are very broad because they are coming from different infection parts, which can cause confusion. But how you can recognise it early is essentially knowing your child is the first thing, and knowing how they are when they're unwell. So children get sick, they get infections all the time. That's nothing new. So if you think about your child that goes to daycare and they're always coming home with a runny nose and a cough, and I can see the parents from here going, yep, been there about 5 times already in the last month. So those things around like runny noses and coughs and colds are manifestations of simple infections. When we start to think about sepsis, we think about perhaps their breathing has changed. So for a couple of days, they might have had fast breathing. Perhaps we've gone to the GP and we're happy that that is in line with a simple infection. But now something's changed in your child, and it may be very subtle. So the breathing rate may increase a little bit more. Certainly their work of breathing may increase a little bit more. So taking big breaths in, tugging around the neck region. If we bring up the little checklist with the circles, Sarah, I can go through that. Probably create a good visual. But what you can do in that is really identify when the illness has changed, because it isn't always sepsis. It's an infection originally, and then sepsis develops. So the time period that varies for different conditions, different children. But if we look at this infographic here, it really articulates it quite nicely. So if we go to the side, we can see a seizure. So that is not normal for a simple infection. If your child's starting to have a seizure, if they're starting to, be on the floor and they're shaking, perhaps they're quite confused if they're an older child, they're not quite making sense, they're very drowsy. And again, that's really important information to tell a nurse when you go to a hospital. The nurse might say, well, you've got a young child, they're sleeping. And you say, yes, they are sleeping, but my child's normally running around, bouncing off the walls. Even when they're sick, they're still pretty good. This illness is different. They wouldn't normally be sleeping at 3 p.m. in the afternoon. Those things are things that I, as a nurse, will not know about your child, but you absolutely will. So I really empower you to express that and communicate that with the team. The big thing is the rash that a lot of us have heard of, and that's because of meningococcal septicemia that we saw a lot of a couple of decades ago. So if your child develops a rash, we talk about the glass test, so it'll be like a little rash that you might put a glass over, and when you press on the skin and the rash, it doesn't fade, it stays there the whole time. That's a little worrying thing for us, where we go, oh, could that be, something we need to investigate? Sometimes it's nothing, but again, that's just a little red flag that we're worried about. Same with the skin, so blotchy, blue, pale skin. That can be a sign that perhaps the body's not getting the blood supply it should be getting, and that perhaps it's struggling for some reason. So if your child is really quite pale, certainly if they're going blue, and certainly if they've got blotchy skin, definitely big red flags to be worried about. If you're picking them up and they're very floppy, so it goes a little bit with the lethargy, but they're just floppy. They're not really holding their body at all. If it's an older child and they can't walk and you're having to carry them, again, that's definitely not normal. And a simple infection shouldn't cause a child to not be able to walk or be that floppy. A lot of people talk about, and again, depends on the age of your child, but if it's a young baby or a non-verbal child, crying all the time, inconsolable, not being able to settle, not being able to sleep, not feeding and drinking, and just really, really irritable, indicates that there's pain going on and we're not sure why. If it's an older child, they might say, I'm just sore, my whole body aches. They're very fidgety, they're very restless. And people that have had sepsis say they had this overwhelming just body pain, not specifically one region, just this overall body pain. But certainly you might have it in one area as well. If we go to the top one, we've got cold skin. So you'll touch your child and they'll just be cold. It might be 30, 40 degrees, depending on where you live outside, but they're freezing and they're just cold. Their skin is cool to touch. Again, that sort of indicates that there might be a bit of a blood circulation, blood flow problem happening that we are very concerned about, and we certainly want you to be coming to the emergency department for that. And the hard to breathe, working hard to breathe, we discussed earlier on, that real can't get their breath, fast breathing, fast heart rate, and really using a lot of chest muscles to breathe. And just also to note that you could have one of these symptoms, or you could have several, or you might have something else. Sepsis is quite a difficult thing to recognise in the early stages, but even if a slight thing isn't right for you and your spider sense is tingling as a parent, trust that gut instinct and convey as much as you can. You don't need to be medically trained to say why you're concerned about things, and certainly asking health professionals, I'm worried about sepsis, could this be sepsis? And ask that question straight out.
Fantastic. One thing I do notice on here, Amanda, which really kind of stands out to me, and I'll just try and zoom in on that a little bit more, is that paragraph there where it says, you know your child best, so trust your gut feeling. How important is that with the recognition of sepsis?
Absolutely incredible. It's so important, and so something that we speak about all the time, that I actually did a research study on that with parents specifically, because we talk about it all the time. And even as an adult with certain things, you get this gut feeling, you get this, intuition about something, that something's not right, whether it be in your general life about something, whether it be after an interaction with someone, you think, oh, it's just something wasn't right there. That feeling you get, never ignore it, whatever it may be. So the same goes for your child. So if you look at them, perhaps you've been to the doctor, they've said they've got the flu, they've got a chest infection, let's give some oral antibiotics, or let's not, just give some Panadol and Nurofen for a temperature. You take your child home, you sit with them for the afternoon, it gets into the evening, and you're like, I'm just not happy. And I know the doctor said, but I am not happy for some reason. Trust that instinct, because speaking to parents that have had children affected by sepsis, and certainly ones that did go to emergencies or really trusted their gut, it absolutely changed the outcome for their child. And even if you're wrong and everything's okay, that's okay. It's okay to speak up and communicate, because you know your child best. And for reasons such as the sleeping example I gave, I don't know when your child sleeps as an emergency department nurse. You do. You can say, no, they hardly sleep at all. They're running around. They've actually got ADHD. This is not normal for them. And I'll go, oh, okay, now I'm a little bit more worried.
Yep, that's it. You know your child best. And I also love there in that paragraph as well, where it says, asking your doctor at nurse, could this be sepsis? And I think that's one thing that's so important, is being able to empower people to actually ask that question. I'm just going to go back to that screen sharing again for a minute, because this is something that I think is just so valuable, which is that checklist, because, you might be sleep deprived. When your kid's sick, you know that, you certainly don't get any sleep. Your brain you're not functioning on all cylinders, let's be honest. So, being
That's me on a Monday. Yep.
Oh, yeah, I know. Especially you haven't had coffee either, because, your child's sick. Absolutely.
Don't even go there. Don't go there.
You're right, I shouldn't. So with the paediatric sepsis checklist, being able to try to go through this bit by bit and being able to present that to a clinician as well. So is this that you could actually fill out, take to the hospital?
Yeah, definitely. So this is available on the Children's Health Queensland Paediatric Sepsis website, webpage, so you can actually get to that. And although each point, you don't have to tick one to say, oh, my child definitely has sepsis. Again, sepsis is, I like to think about it as a puzzle. So you've got multiple pieces of a puzzle that when they start to fit together, you go, oh, actually, could this actually be sepsis that I'm dealing with? And that's unfortunately the nature of sepsis. If there was just a few factors that go, okay, yes, you've got sepsis, it would make it a lot easier to recognise early. But it's all about trends as well. So again, perhaps you've seen a doctor, you've been given this checklist, you've gone home, but now you're noticing that there's been no wee or wet nappies for 12 hours. Again, that's not normal. That could indicate some kidney failure, okay? So something that we'd be quite concerned about, because they might have had a simple urine infection, but now their kidneys are kicking in. They're still having perhaps a little bit of fluid, but they're now having decreased wet nappies. You can tick that and take that to a health professional and say, these are the things I'm concerned about now. My child also can't stay awake. They're really drowsy. So those two things together, I might go, oh, ding, ding, I'm very concerned about this child now, because 6 hours ago, these things weren't an issue. I was happy that they had a urine infection and it was quite simple, but now they're getting worse. That this illness is not performing, shall we say, in line with how it should. They should be starting to, get a little bit better with some Panadol, Nurofen, a bit of treatment, a bit of fluid, but now they're getting a little bit worse. That might be the next day, it might be that evening. It's different for different children, but by taking a box, us nurses and doctors sometimes we have a lot going on in our brain, but to be handed something and say, could this be sepsis? This is what I'm concerned about. This is how my child has now changed in how they were 12 hours ago. I'll go, oh, okay, thank you. You've clearly laid that out for me, and it's now right in the front of my brain, and we'll investigate that and definitely look into that further.
Fantastic. And we've put the link to that checklist in the comments below as well. So please download that. Have that as part of your parenting repertoire. Hopefully you never, ever need to use it, but it is a great thing to have. And I think Amanda really highlighted something incredibly important there, and that is the fact that things can change. It is okay. It is really, really important that if something changes, to go and seek medical help again. And that's the nature of it, that, sometimes things can change very quickly, and it's about going, okay, this is different. I need to seek medical help again. And that's so important that you feel empowered to do that.
And it's a common thing that keeps coming up. Like, certainly what we do see is these representations. So whether it be to a GP, then to a hospital, if you don't represent because something's changed or you're still concerned, then your child can get worse, unfortunately. And the earlier you get this, and it may just be one little change that you pick up on as a parent that completely makes all the difference. So don't be worried about being that person that goes back all the time. If you have concerns, we really want to help, and we really want to hear them, because that is why we're in this line of work, to help people, to help you, to help your children. So please let us know what you're concerned about.
Yeah, that's it. So, Amanda, I reckon we're getting some questions now, because we've got some really good ones popping up. So let's start. Yeah, here we go. Okay. So Rebecca's asked, if their skin is cold, can they still have a fever?
Yes. Yeah. So that's a really good question. So the fever is people often associate, obviously, every child, like if they've got sepsis, they must have a fever. That's not always the case, though, as well. So they can have a low temperature and have sepsis. They certainly can have a high temperature and have sepsis, or they can just be unwell and have a temperature, which is more often than not what we see, and then not have sepsis at all. So when we talk about skin being cold, if they've just come out of the pool, obviously that's why the skin's cold, if they've had a cold shower or something. But if you touch their skin and it is cool, it might even be a bit clammy, perhaps. It might be, with that, you can see they're a little bit pale. And they shouldn't be, because the environment is normal. Your skin temperature is normal. That's something to be concerned about. We also know as well that you have a temperature, if you have some Nurofen and, paracetamol, that the temperature may well come down. It doesn't mean they're cured from the infection or they're cured from sepsis. We're just getting that temperature a little bit down. So yes, yep.
Okay, excellent. Now, Liza has asked, will the recording be available? Yes, we are going to have this on the CPR Kids YouTube page and Facebook page. So it's there for you to share around to everybody who you think needs to know this incredibly valuable information. It's going to be there for them to watch. So a definite yes with that one. Now, Shiva has asked as well, her question for you is, first of all, thank you for alerting us to the fact that tomorrow will be World Meningitis Day. Thank you for that. And also, Amanda, what is the difference between septicemia and sepsis? Is it language, or is it something different?
Excellent question. And I might tie into something. I tend to do this. I go off on different tangents, but it's all relevant, I promise you. So the difference between septicemia and sepsis is nothing. So septicemia is an old terminology that people used to use, saying someone's got septicemia. That's essentially they've got sepsis. Without going, again, too fancy or anything, there's sepsis and there's septic shock. It's just a different degree of sepsis per se, but as family members and parents, you don't need to worry about the differences in that. Sepsis, if you hear the word sepsis, if you hear the word septicemia, similar thing. And certainly people also talk about blood poisoning. That is another old school terminology for what was sepsis. But as we've evolved over the decades, we have learned more about the condition and what it actually is. So it's not blood poisoning. The reason perhaps that was sort of used in my mind is because the infection is going throughout the body. Well, sorry, not the infection, the results of the infection is involving the whole body. So that perhaps is why people started to think of it as blood poisoning. And you hear people say, oh, my Nana Joyce was 90 and she died from blood poisoning. Well, no, she probably died from sepsis. She had pneumonia perhaps, and the body overwhelmingly responded to that pneumonia and started to damage things and cause organ failure. That is sepsis. So, but people still call it blood poisoning, but we now know the correct words is sepsis.
Okay, very good. So let's go into a few more questions that we've had come through. Thank you for answering that. So the next thing is Millie has said, I read a story recently about a little girl who developed sepsis from an unknown UTI. As a mum, this is really scary. How does this cause sepsis and what else can cause sepsis? So you've touched on this. Well, actually, I think you've probably explained it really well earlier. Can you just give a little recap about how something like a UTI can cause sepsis?
Yeah, of course. So again, we know childhood infection is really common. Now, that's not something to be scared of. Every child's going to get sick. That's the first thing that we know about. And it's not something to panic and wrap our children in cotton wool and all that. They're going to get sick. It's the way their body starts to develop as they get older. So a urinary tract infection, for example, your child may have a urinary tract infection. Perhaps the GP gives them some oral antibiotics. They're going to be miserable for a little while, but they get much better. For some children, and we don't know why, there's believed to be a bit of a genetic link perhaps, or, some cellular things, some fancy science words that are way smarter people than me can explain. But for some reason, some people get sepsis and are more susceptible to it than others. But things that we do know about it, that are people that are more at risk are children that are less than 3 months old. So we know our little babies, our little tiny babies less than 3 months old. And that makes sense. Why? Because they don't have a mature immune system. Okay, so that makes sense. They get an infection. The body doesn't quite know what to do. It starts to try and fight off the infection, but perhaps gets lost along the way. And they get this response and they develop sepsis. So children less than 3 months. When we talk about children and adolescents, those under 5, again, are a little bit more higher risk, again, just under 5s, but under 3 months are the big ones. Who else? Children perhaps of Aboriginal Torres Strait Islander background, a little bit more at risk. Children who are having chemotherapy and adults that are having chemotherapy, again, makes sense. Their immune system is a little bit compromised because of what they are having done. Who else? But for whatever reason, the UTI suddenly does not become simple anymore. And even though that was their original infection source, the body's taken over and started to involve the whole system. And the things we don't talk about are around like skins and scabs and falling off push bikes. Burns is another one that we don't really think about. You can even get it from a mosquito bite or a boil, a skin boil. So things that we don't really think about. But just if you keep in your mind, any infection, it doesn't have to be bacterial, it could be viral. If we think about the COVID-19 pandemic, a great example of viral sepsis that was. And depending on where you live, fungi, parasites. But if you just remember any infection, but it's when that infection changes from it being simple to suddenly the whole body being involved.
Okay, a great explanation there. Kylie's got a question, which is it ever possible to catch sepsis from someone?
Excellent question. In short answer, no, it's not. It's not contagious. However, the original infection source may be. So again, let's use meningococcal as a great example, and that's one of the big ones and big bacterias that often does cause sepsis because it's such a nasty, nasty bug. So if we remember back when I was at school, which feels like 50 years ago, suddenly you weren't allowed to use the water bubblers because there was a meningococcal outbreak, and that was obviously because saliva was transferring that pathogen around. So the sepsis isn't contagious, but certainly infection is. And once you have an infection, you're more at risk of sepsis, even though that chance is low. You can't actually get sepsis from someone.
Okay, excellent.
Great question.
Yeah, I know. I love that question. And thank you to everybody who's submitting these questions. They're really good. Yeah, I love this. This is great. So Becca said, why is sepsis so hard to diagnose or spot? So she said she's seen an episode of Australian Story about somebody who was septic and was misdiagnosed. It was a hard watch. So why is it so hard to diagnose or spot?
Yeah, I know, and thank you for sharing that. It is incredibly hard to watch, and even in the role that I've done now for quite a long time, the cases that you still hear and the families that you meet is still incredibly challenging because it changes their lives and it can change people really quickly. So it's difficult to spot and recognise because it can mimic less severe illnesses, essentially. So again, let's use the example of a chest infection. Perhaps a child has a chest infection, so they've got a temperature, they're breathing quickly, they are using those extra muscles around their chest and their neck to help them breathe. They are sick anyway. Now, that could just be a chest infection, but it could also be the earlier stages of sepsis. But sometimes we don't know until, again, like the puzzle, we start to piece it together. So sometimes something will change in the span of 10 minutes. Suddenly sepsis has become, it's taken over, and it may be over a little bit of time, or for some children it can be really quick, and we notice suddenly they're really drowsy, suddenly they're really floppy, suddenly they're not making sense anymore, and that may have only been in the last half an hour or something, or an hour, and that's just to do with the nature of the condition, unfortunately, that it is really quick. So it's difficult because those early signs absolutely can look like a normal infection that you have going on, but it may be that you've got all those breathing things going on, you know your child has a chest infection, but then they become really sleepy. You can see how that's a really easy sign to miss because maybe it is bedtime, or maybe they've haven't been sleeping. So you can justify that a lot. That's why it's easy. But again, if you're concerned about that, raise that, because it may not be just that they're sleepy and tired. It may be that now they've got some brain issues happening, and there's not enough oxygen getting to their brain, and they can't function properly. So again, verbalize that, and we go, oh, this is now no longer a chest infection. They've got now they're not giving enough oxygen in the rest of the body for some reason.
Yep. And, the good thing is, even if it's not that, even if they do then become, awake and interactive again, that's okay. That's just still raise it anyway. Okay, that's the important.
Yes. Yes.
Definitely.
If you remember one thing from today, it is trust your gut and always be that advocate for your child, as I'm sure you all are. But don't be scared of doctors and nurses. We're lovely people at 3 a.m.
That's it. Now, we have still got quite a few questions. So if you have asked one, we are getting through them. So please stick with us. So next we've got Jackie.
Like I'm on the $50 minute or whatever it's called.
I know. Quick, keep answering them, Amanda. Let's go. So does treatment differ depending on how sepsis developed, and can it be treated and stopped quickly once it's started?
Okay. So as a general rule, again, the treatment for sepsis is the same depending on what stage it is at, if that makes sense. So, for example, we take some bloods, we may have to give some oxygen. We give antibiotics in the vein. We give a little bit of fluid just to help with that, keep getting the blood around the body properly. If the child really needs it, they'll have a medication that will just help their heart a little bit as well, but not all children need that. So that's one thing that may be a little bit different. It can be stopped quickly if you get it early. That's a difficult part to answer because it does depend. For some children, they can start to get on top of things and help get the child better, but it may be months of recovery. And it may be days until they start to get quite well. They might be on a breathing machine for a little bit of time as well. Some children, perhaps not. Some children, within a couple of days, they're feeling much better. So it depends on how quickly their treatment begins. The longer it takes to get that initial treatment, the longer the road to recovery is. And that's why, again, getting it early, you're going to have a much better chance of recovery than getting it quite late. When it starts to get late, it can be very, very quickly, they can become very unwell, and that's quite challenging. The only other difference thing as well is depending on what the original infection was, people can have multiple types, but depending on what the original infection was, the antibiotic choice will change. But otherwise, treatment is very similar, and we follow like a little pathway that tells us these are the things that we need to do if someone has sepsis.
Fantastic. Excellent. So good. So Ross has said such great information to be shared. Thank you, Ross. I appreciate that. Please, everybody who's watching, please share this around. The more people who know this information, and especially the resources, which we put the links to, the more people who print this out and stick this on their fridge. And there's postcards as well, which show that little infographic and so on, which I'll put a link to in the comments below as well. The more, having this as part of your parenting armor is so important. So please do that.
And speaking to about your friends as well, like talking to your friends about it, and you'll find it's more out there as well than you realise. It's just not something that we speak about, and having those little postcards on the fridge are really helpful because you go, oh, actually, hang on a second, I didn't think about that. Sometimes something needs to be right in front of our face before we realise it.
Yep, it does. Absolutely. So Liza has asked, just off a comment before about using water bubblers, Liza has said, do you recommend using not using water bubblers in general? I must admit, I do use a water bubbler. And my kids do as well.
Yes, I do as well. I mean, it's when that happened, that was now, oh gosh, I'm going to show my age here. Probably 20. Oh, that's terrible to say. 20 years ago. Goodness me.
You're younger than I am, Amanda. Don't worry.
Thanks. I'll keep that for my Wednesday. And we knew it's spreadable in saliva. So even though the chances are quite low, meningococcal was a real concern for people, and it was killing people quite rapidly. So I think in that respect, using public bubblers, of course, you're going to slightly put yourself at more risk because it's a shared thing of getting an infection maybe, but people shouldn't be putting their mouth over the end of bubblers anyway. Again, some people may, who knows, we won't go there. But really, I think that's a personal choice around, or what you feel comfortable doing with yourself and your children. And at the end of the day, infection is out there. Touching shopping trolleys. Again, we learned about COVID-19. Some of the best things you can do to avoid infection is basic principles infection control. So washing our hands, using sanitizer if we need to, not coughing out everywhere in public, staying home if we're unwell. But unfortunately, the day and age that we live in, people will get infection, and it's everywhere from touching lift buttons. So it just depends on what your risk threshold is of how comfortable you feel with things.
Yeah. Okay, fantastic. All right, very good. Now, Shiva has asked another question too. I've heard the sepsis community have done some great work to make changes to get this recognised more early. Just wondering how they did this. So what's some of the work that that yourself and your colleagues have done to get sepsis awareness out there?
So I'm very blessed to work in an amazing team, and I'm only one of many that really over the last five and a half years now, really focused on health services originally, but then we realised, well, hang on a second, parents, communities are absolutely key in this, because as we just discussed, if the child's really, really sick and they're coming in really, really unwell, their chance of recovery is reduced. So how do we change that? So we really partnered with a lot of communities, a lot of groups, a lot of networks, a lot of different states as well, to try and develop a bit of public awareness out there. And that, again, just wasn't through Queensland. That was through a lot of Australia and also some international friends that worked on basic principles of what actually is sepsis, and let's make sure people understand it. If we, and still to this day, like, it shocks me, if you went and asked people on the street, what's one sign of a heart attack? People would say, oh, chest pain. What's one sign of a stroke? Oh, slurred speech, or perhaps walking funny. And then you'd say, well, what's a sign of sepsis? And people would go, what? Sepsis, what's sepsis? So that was a big thing to go, well, the community needs to know that. So partnering with all those groups. Also for health professionals, developing a lot of education and training for them specifically, developing a lot of posters, resources, and we might bring up the family page as well now, Sarah, if we could.
Oh, no problems.
And posters around just really getting the word out that this is what sepsis is. Have you heard of it? And it doesn't have to be complicated. It just can be, have you heard about it? If you're concerned about your child, make sure you mention the word sepsis and you just have a bit of an understanding of what it is. Lots of videos, lots of webinars, lots of easy access things that people can tap into, and also knowing our friends in communities that aren't close to health services. So we've done some trips out rural, regional Queensland to make sure they've still got that available as well. If we just go to the top, if we go information for families, sorry, to the left.
Sorry, hang on. I will.
I'm trying to click myself.
Done.
Back one again, sorry. Just back to that main page.
There we go.
And then, so see that to the left, could this be sepsis? Yeah, yep, that's the one. Perfect. There we go. So we have some amazing social workers in our team that really developed and spent a lot of work in developing resources for you guys specifically as family members. So in terms of creating a network for parents that have actually had a child that has had sepsis, also developing a video series, because we know I love learning by videos. I get bored of reading. I know that's ironic having a PhD, but anyway. So if you, and this is available to anyone, if we click on that middle banner here, this is really a journey, and this will answer some of your questions on a visual front to show what can happen to someone with sepsis in the different stages. And this walks you through a patient and what their journey is and what you can expect. So again, it's not such a foreign concept. If we scroll down, there'll be some videos. Yeah. So fantastic social work team and some very kind and generous family members that have shared their stories around their child that had sepsis, and what you can do about it, what actually is. And if you are in the hospital, just so it's not so scary, what can you expect? And then there's also more resources there for families as well. So anyone can access this part wherever you are in Australia. And I highly recommend you do it, just because knowledge is power, and the more you know about this and the more awareness, then this is exactly how we combat this horrible condition.
Absolutely. And we've shared the links to those in the comments below. So all of this is right there. Or even if you just Google Children's Health Queensland sepsis, it will come up as well. So that is fantastic. Now, just one more question that we have before we wrap up today. Alice has asked, how long is the time frame for medical attention? Now, I'm sure that is an incredibly difficult question, but how can you answer that? I think
it depends, and I know that's a very frustrating answer, and it's frustrating to say as well, but it really does depend, because even though sepsis is sepsis, there are different degrees of it, and that there are different responses and how much perhaps resilience the child has to what's going on in their body. So again, if we get it really early, we know that the outcomes will be really, really good. If we get it late, we know that will perhaps be a little bit worse. And obviously the worst outcome is that the child dies, and we really don't want that. So it does depend. When a child has sepsis, we want to get medical treatment in within 60 minutes of a doctor saying this child has sepsis. So that's the time period that we work off in a hospital, 60 minutes to give antibiotics, to get blood cultures, to take bloods, to give some fluids. However, you in the community, the child may have had sepsis 4 hours ago, and you know, they're at home with you and you didn't know, you're keeping an eye on them, and then you took them in. That's okay as well. So there's no exact time frame, but what I would recommend is if that little postcard with those circles, if you notice any one of those things, or something's not right, or your child's changed in a different way and this illness seems different, then go to an emergency department ASAP, and don't waste any time. That's the best, because there's no exact answer for that. But those big things are things we're definitely worried about, and we definitely want you to come to, so we can have a good look at the child and then start treatment if we need to.
Fantastic. So I think that this is certainly one of the things that, if you, as Amanda said before, if there's nothing else you take away from this, trust your gut. If you think that there is something wrong with your child, seek medical help, and don't be afraid to ask, could this be sepsis? So thank you so much, everybody, for joining us. If you're watching this recording, we hope this has been useful. Please share far and wide and have conversations about sepsis. Know what the signs and symptoms are. And Amanda, what message would you like to leave us with today?
Oh, gosh. There's many messages always from me. But I think the key message is essentially trust your gut. Don't psychoanalyze it. Don't overthink it. If your gut is screaming at you, something's not right, trust that. Articulate it the best you can to a hospital staff member, but also don't worry if you can't. Just say, these are the things I'm worried about and why. I think as well, knowing that you are not just the parent, like that's a big thing. You are a key part in the medical team and that decision making. And you absolutely know, even if you have no medical knowledge, you know things about your child that I certainly will not know. But they will absolutely let me, that information will translate in my brain to medical chat, and I'll be able to go, oh, okay, this is a reason why I'm now a little bit more concerned with that. I think the other thing is know the language, and know if someone's telling you, look, your child's just got chest infection, we're happy you can go home. If you're still not happy, you can say, this isn't sepsis, this is what I'm concerned about, because medical professionals are really, we've got a lot of cognitive load going on, and most children don't have sepsis. Most children have a simple, uncomplicated infection. But sometimes you need someone to almost put a big sign in front of your face and say, hold on, could this be sepsis? And when that's planted out there, you go, oh, actually, okay, hang on a sec. This is why they're concerned. And it gives you a second to just recoup. So don't be afraid to do that, and really be empowered to speak up for your child, and represent if you're concerned. And that's the big thing. Just because the doctor said you're okay, things can change quickly. So it is okay to go back. You're not going to get in trouble.
Yep, 100%. Such amazing messages. Thank you so much, Amanda, for sharing your incredible knowledge with us. Everybody who's watching, I hope that you have taken those important messages away. As I've said multiple times already, please share, because the more people who know this, the better. It actually does save lives. So, Amanda, thank you for sharing your knowledge, and I hope that you will come back again and do some more live streaming with us out to everybody here. And remember, everybody who's watching as well, please DM us. Tell us what you would like to please know. Okay, what do you want to know about? Because that's why we're here, is to bring you this good evidence-based medical information. So thanks, everybody. We'll see you soon. Bye.
Thank you.